Hi, everyone. This is Dr. Beraha from the Cayman Heart Fund. We're almost ready to start. I just wanted to start welcoming and allow people the time to make sure their devices are working and they can hear me well. So welcome everybody to our Zoom webinar. As I said before, my name is Dr. Bella Beraha, and you're joining us today to learn more about heart health. Our topic today is matters of the heart. And the reason we're having this webinar is for World Heart Day, which we celebrate today, 29th of September, is a worldwide event. And the reason for this event is so that we can have an opportunity to create awareness around heart health. So I'm very happy to have everyone here. And I just want to do a few housekeeping items before we get started. So as you know, you're joining us via Zoom. You're going to be seeing my screen, which is our slides, and I'll try to go over them as clearly as possible. We do have a Q&A enabled, which is at the bottom of your screen. So when you do think of a question, feel free to type it down, but we will only be addressing as many as we can and at the end of the talk to avoid interruptions. I really wanted to thank you for sharing your lunchtime with me. It means a lot to us in the Cayman Heart Fund. I was very excited to see as many participants sign up as we have. It's a great opportunity, as I say, to create awareness. A few other reminders: you can click audio settings and choose how you hear me. The chat feature is disabled. And as I said before, questions and answers are on the Q&A button at the bottom. We will record this webinar and it will be made available as soon as possible after the event so that you can go back to it or share it with people. I would also like to take a moment to thank a few of our supporters who help produce events such as this. First of all, we're coming to you from St. Matthew's University, who always host us, so thank you to them. I would like to thank Ali, our coordinator, who puts this event together and does all the behind the scenes work. And we have board members such as Katie O'Neill, who's today with us, just making sure everything is working well. As I said before, the whole point is to create some awareness and learn. So my talk today will be focused mostly on preventative measures. There's a lot of talks that you attend to do with heart health that focus mainly on what to do if you're having a stroke, what to do if you're having a heart attack. And while those are all important and part of what we educate here at the Cayman Heart Fund, I thought I would take the opportunity and talk to you more about how to prevent having cardiovascular disease. The reason why we talk about cardiovascular disease is extremely common. It is almost inevitable. Most adults after the age of 60 will have some form of either risk factors or cardiovascular disease. It accounts for about 17 million deaths worldwide every year. And in Cayman Islands, it is amongst the top causes. So if we look at our statistics from 2005, which are pretty much have held steady for the last few years, the top causes for mortality include cancer, and then right afterward is ischemic heart disease and cerebrovascular disease. So if you join those two, it probably surpasses cancer deaths. And although these numbers are alarming, we must recognize that we've made great advances when it comes to how to manage some of the cardiovascular diseases such as heart attack. So for instance, mortality after having a heart attack, so that's your risk of dying afterwards, has decreased by 50% since the year 2000. So this is great, but our optimal goal is to reduce the heart attack from happening at all, not just to be able to be amazing at managing it. So a little bit more about those numbers and why this is so important. This comes to us from the American Heart Association, and this slide was created in 2018. Some of the statistics are pretty much the same. So it covers a lot of the things that are risk factors and diseases associated to cardiovascular disorders. So as you can see, the numbers of people who have high blood pressure or heart failure are huge, in the millions in populations such as the US. If you add to that the 23 million of people with type 2 diabetes, which is preventable, you can see how we start to add up those people who are going to be having heart attacks or strokes. We still have a very large percentage of people who are smokers in adulthood, even though all the campaigns to stop smoking and it being one of the primary risk factors for these diseases. At the same time, we can see how in 2014, and this number is even greater now, 38% of the adult population in the US was obese. When I keep talking to you, I keep referring to cardiovascular disease. And so I want you to understand that the reason why I call it cardiovascular disease and not heart disease is because these 4 diseases that you see on your screen all have the same mechanism of how they occur. And so they share risk factors. The most common of them is going to be the heart attack, but it doesn't mean that if you've had one of these 4, you're not at risk for the others. And that you usually have some minor expression by the time you have one or the other. So as I was saying before, you can see here, the first one is what we call coronary heart disease. So coronary are those vessels you see there on the screen that feed the muscle of the heart. And when plaque of fat accumulates in those vessels, it stops oxygen flow and creates the heart attack. The next one is cerebrovascular disease. So similarly, as you can see there, those are the vessels that feed your brain. And there is a plaque with a clot that stops some blood flow and cut. And as a consequence, you have a stroke. Then you have one that is probably less recognized, but also happens for the same mechanisms, which is called peripheral arterial disease. So those arteries that go from your belly button down into your legs. So as you start to get occlusion in those, you can get pain in the legs when you walk and different manifestations of lack of blood flow. Lastly, even though this was not a blockage, it happens for the same exact reasons and risk factors. You can have this pouching of arteries or this sac-like protrusion called aneurysms. There you can see one in the belly, which is called an abdominal aortic aneurysm, but these can happen in other parts of the body. So as I was saying before, when we go through this chat, everything that I'm going to mention, risk factors and preventative measures, are all for these 4 diseases that we call cardiovascular disorders. So as I was mentioning, when you have one of these disorders, such as peripheral artery disease or the arteries in your neck, carotid disease, you have the same risk of having a future heart attack as those patients who already had a heart attack. So that puts you in the 10-year that exceeds 20% risk. And that's why if you've had in the past a stroke, we consider you at extreme high risk of having a heart attack or one of the other ones. When we talk about how to prevent, we have to remember there are 2 types of risk factors that we can address. So we have those that are modifiable. So as the word implies, you can change them. And you have those that are non-modifiable. So the things that we can't change, and I'm talking to you about this because it's just to take into consideration, it brings you at higher or lower risk, are things like your age. So as you can see there, once you start to get over the age of 40, when we do your lifetime accumulative risk of having any of these cardiovascular disorders, it starts to go up to almost 50% for men and over 32% for women. That's after you go from younger age. Then we have sex and gender, which is not just a linear thing. Depending on female or male and your age, this risk is different. A very important one, and that you should always share with your physician, is your family history. So if you have a first-degree relative, that means a parent or a sibling that had a cardiovascular disorder, for males before the age of 55, for females below the age of 65, that puts you at increased risk. We have certain races and ethnicities who have higher proportion of cardiovascular disorder, such as Afro-Caribbean, and then some forms of congenital heart defects, just because they affect the way the vascularity, so the vessels are, can also predispose you. Now we get into the important part, because this is where you can make a difference. And this is why you go to the doctor or the free health screenings to learn things. The first one is your cholesterol. So decades ago, we only cared about the total cholesterol, so the big number. And in some slides coming up, you'll see how that has changed over the years. Then we go into diabetes. So once you are diagnosed as diabetes, and that's independent of type 1, which is the one as a child and from deficit of insulin, or type 2, which is more associated with obesity, your mortality risk or your risk of having a heart attack is the same as a person who's already had a heart attack. So you can see how that is extremely critical. So even if your sugars are controlled, you're still at extreme high risk. And that's why we are obligated to have very different standards of other numbers for people with diabetes were more strict. Then we have the next one, which is one of the most prevalent disorders in the Western Hemisphere, which is high blood pressure, which is important to know. And you'll also see that in some slides and coming up, how the guidelines keep changing and we become more and more strict as to what we consider normal blood pressure. The next one is obesity and what kind of diet you have, because in obesity is more obvious that we need to change dietary patterns to improve your health, but there are plenty of people out there that are slender or non-obese whose diets are promoting inflammation and heart disease. Smoking, as I mentioned before, there's still a great proportion of the population that smokes. And if you smoke a pack per day, it will increase your risk of a heart attack 3 to 6 times that of those non-smokers, 3 for women, 6 times for men. And it's important to note as well that even if you're older and smoke, when you quit, you always gain heart. So when you take all these risk factors together, they're responsible for probably over 50% of the cardiovascular deaths per year. So you see how changing this can make a great impact. These slides are a bit complicated and cumbersome, so don't stress yourself too much, but they're just meant to show you that as you start to add risk factors to age, your y-axis goes up in your risk of having heart attack and cardiovascular disease. And you can see the comparison between women and men. But if you have optimal risk factors, which is that bottom lavender line, you can see how the curve sort of has a little bit of a peak as you get older, but then it stays stagnant because it doesn't start to worsen. Only if you start to accumulate things like high blood pressure, obesity, and diabetes, it starts to get steep. Same, and this is kind of just a different way of looking at the same thing. You can see there the reference population, and you can see blood pressures in the different colors or shades of the bars. And then you can see the 5-year cardiovascular risk. And then you can see as you add increased cholesterol or smoking or low good cholesterol, or if you're having diabetes or even just age by itself. So you can see that some things like age you can't change, but you can see the great impact things like diabetes have on mortality. So when we talk about prevention, we already spoke about risk factors. We also can talk about 2 different types of prevention. There is primary prevention and secondary. So primary prevention is our goal. That means before you develop any type of disease, we're going to prevent it by taking certain measures. Secondary prevention refers to when someone already has a problem, such as had a heart attack or a stroke, then we try to diminish the risk of having further problems related to the same reasons as to why they had the problem in the first place. So one of the biggest impacts you can make for primary prevention is going to be changing your eating habits. So there's been a lot of diets out there, and most of the ones that show benefit share certain basic principles. One of them is to lower processed foods and high glycemic index foods, or that means simple sugars and starches. You also have to make sure your diet is rich in lean, healthy proteins, healthy fats, and plenty of vegetables and fruits. So as you can see here, this is not a traditional plate diagram that you will see in most dietitians' offices or even that we learned in school. This is more of an evolving science where we're recognizing that it's not just the distribution that we used to learn that's important, that a lot of the constituents we have to recognize that are not all created equal. So that in particular for fats. So as you can see in this pyramid, there is absolutely no limit, and we promote as much as you can of the non-starchy vegetables. So when people say plant-based diet, this is what they mean. They mean you're going to be eating, you can eat animal sources of protein, but your plates and your daily vegetable consumption or plant-based consumption should be 70 to 80% of your intake. Then you should have about 3 to 5 servings of your lean or healthy proteins mixed in with your healthy fats, which are those known as your omega-3 fats. So the prime example there being the salmon and the nuts. Then you still have important representation every day, but in a lesser quantity of those things that are starchy or higher in sugar. So even though they come from nature, you still have to mind your portions. But vegetables such as the sweet potato and pumpkin and fruits, there we picture the berries because they have a lesser impact on your sugar. We continue onwards with beans, legumes, and grains that are non-starchy, and then spices and herbs. And then you can see at the very top of the pyramid what you shouldn't indulge in, and especially not on an everyday basis. And the donut is meant to represent all your sweets and pastries, and also there you can see the alcohol. So these are supposed to be recreational treats. So in essence, this constitutes the basis for the Mediterranean diet. Other things you can do for primary prevention that will have a great impact. First and foremost, to stop smoking, control your blood pressure, your cholesterol, and so know your numbers. Go to your doctor, go to the screenings, find out where you stand. Even if you feel okay, you're still supposed to know these numbers. Exercise. We see benefit with any amount of exercise. Obviously, optimal, according to the American Heart Association, is going to be 150 minutes of moderate cardiovascular exercise. So this just means brisk walking, anything to get your heart rate mildly up. Alcohol. This one is one that's highly debatable. So the pendulum will go different directions, but for the most part nowadays, it's considered that no amount of alcohol should be promoted for health. But if you have small amounts, you can still be not causing great detriment. But the key is that you shouldn't have more than what is recommended. When we spoke about the numbers, and I kept referring to, you'll see in future slides how things have changed, I can highlight a few things in this slide. First of all, as I said before, decades ago, we only cared about the total cholesterol, but now we know there's breakdown to cholesterol. So currently, the guidelines tell us that our bad cholesterol, which is the LDL, and we can remember that by the lower the better, should be 100 or below. Again, this should all be tailored to your particular risk factors. Then HDL, which is the higher the better, optimally over 50. Your triglycerides, which come from excess sugars, should be below 150, and that's part of the lipid profile. Your blood pressure, which years ago we used to say 130 over 80 and below, and we wouldn't treat until you were 140 over 90 or above. We're now more strict in keeping you below 120 over 80. Your fasting sugar, so that's your sugar before you have any food in the morning, should be below 100. And as I said before, you should be doing exercise. Your body mass index, which is the relationship of your weight to your height, should be 25 or lower. And then more telling than the body mass index is the waist circumference, which should be less than 35 inches for women and 40 inches for men. And that's measuring your waist at your belly button level. Going on with primary prevention, as I mentioned, obviously exercise. And there you can see a depiction that if you do these things 5 times a week, 30 minutes of brisk walking, as you can see there, or you do more intense, for instance, 25 minutes of very intense exercise 3 times a week, then you are completing what we need for you to do in terms of cardiovascular. But you should add, and this is for health to your heart as well as other things like your bones, strength training at least twice a week. To summarize, some of the benefits of places like the Cayman Heart Fund and what we do is that we provide free health screenings where we can provide this information again to you, and we can also test things like your body mass index, your blood pressure, and give you your numbers. And this will be a great stepping stone for you to know what you need to change in order to optimize your health. I just wanted to add a few words about aspirin, but this is not the main objective. And the only reason is that I bring it up is because there's a lot of debate always. So just to know, when we talk about primary prevention, so preventing any cardiovascular disease before it happens, the protective dose of aspirin is what we call a baby aspirin. That's 75 milligrams or 81 milligrams. You don't need to take a full aspirin. Now, we do recognize more and more that there are effects to even taking a baby aspirin, and people may become at risk for bleeding, especially if you're over 65 or you take other medications like ibuprofen or steroids or other blood thinners, or if you've had a history of ulcers in your stomach. So again, before going on an aspirin, I would definitely ask the doctor, because before we used to put a lot of people on it that maybe don't gain as much benefit and do gain risk. But again, this is for primary prevention. So if you've already had a heart attack, a stroke, or have even things like diabetes, then aspirin benefits far exceed the risks that I just mentioned. A couple of slides about women where it comes as a subject of cardiovascular disease It's still the leading cause of, it's still the leading killer of women in the US, and it causes 1 in every 3 deaths. And again, this is cardiovascular disease, so heart attack, stroke, and other cardiovascular disorders. More women die of heart attack than men, and that's not really because it's deadlier, the event, but just because they probably don't seek help, or their symptoms are not as typical, so don't get help as fast. More women die from heart disease than they do of breast cancer. And most women have at least one risk factor for cardiovascular disease. So here's a comparative slide to show why sometimes women are less diagnosed and treated less aggressively. It usually develops cardiac disease later in life. The blockages of the arteries tend to be in smaller arteries, so this makes it harder to diagnose. They're in general treated less aggressively. Women themselves are less likely to call 911 and attribute their symptoms to something different. They have very unique risk factors like hormone changes, going through menopause, taking hormone replacement therapy, diseases such as lupus that are more prevalent in women. And that goes also to the rare conditions mentioned there. And they have more subtle and non-typical symptoms. So this is a slide that again depicts this, and you can see how more women have certain issues and how they tend to seek help less often. And here, just to further reiterate on the difference in symptoms, and this is not an absolute, still the majority of people have pretty classic symptoms when it comes to a heart attack and stroke, but sometimes women present with different things such as nausea and extreme fatigue, pain in the arm more than in the chest. Sometimes even as they feel like they're hyperventilating, so they feel like they may be anxious, or they have the pit of the stomach, the loss of appetite or shortness of breath, whereas more men have the classical chest pain, elephant in the chest type of symptoms. Just a few words to say why we also need to create even more awareness around not just cardiovascular disease, so heart attack and stroke, but the risk factors that lead, such as high blood pressure and diabetes, is because since the pandemic, we have now realized how these conditions and risk factors don't only affect the end organs that we spoke about, like the heart and the brain, but they actually affect our immune system and capacity to respond to diseases. And that was highlighted by the severe increase in mortality and severe illness when people get infected with COVID-19 and have not just cardiovascular disease, but some of the risk factors such as high blood pressure. So this is just a reminder to promote to the population listening out there to get your vaccine, because even mild disorders such as high blood pressure could put you at extreme risk. And there you have what is available on the health services authorities and the vaccination and COVID website, our current schedule for vaccines coming up. So that sums up my theme today of matters of the heart and focusing on preventative measures. I would like to now, well, first and foremost, thank you again for attending and paying attention and creating awareness. And then I would like to read out loud some of the questions. So one of the questions say, when we look at healthy and unhealthy fats, those that are saturated versus not saturated, does it matter if the source of the fat is plant-based, like avocados and nuts, or animal-based? The subject of fats is complicated, and it obviously goes beyond the scope of this, and even it's still being debated. So plant-based is in general healthier, but it doesn't discount some animal sources of fats as very healthy. And plant-based fats, some of the omegas don't include those essential omega acids that you can only find in things like salmon, for instance. So fish are going to be your staple of animal-based foods where fats are extremely healthy. And to remember it, there's a mnemonic called the smash fish, which are your sardines, mackerels, anchovies, salmon, and herring, which are your highest omega-3 containing fishes. So although some of the plant-based foods, including nuts and seeds such as hemp, chia, flax seeds, have omega-3s, they don't have the same types. So you still be better off adding some of this. When the subject goes on other animal sources, then it gets even more complicated. So in general, poultry and eggs, we promote organic for just general health, maybe not just targeted to the heart, but general health. And when it comes to beef, most experts in nutrition nowadays don't discount that beef can be part of a diet as long as it's in moderation and as long as you try to consume grass-fed beef, because the fat that gets created in the tissues in the beef is different when the animal is fed on plants versus meaning grass versus grain and other altered. So I hope that clarifies that a bit. How does the amount and size of lipid particles correlate to the artery plaque, and how can you be sure whether you have the right size LDL and HDL? So this is a very good question. It's a very complicated and difficult question to answer. There is no standardized recommendations yet for us to, when I say us, I mean doctors make absolute recommendations when it comes to particle sizes on the fats that we test. So for those of you who've never heard of this, I went before and I said, before we used to only care about the total cholesterol. And then for the last few decades, we'll be breaking down the cholesterol into the low density particles and the high density. And that's the what we call quote unquote bad cholesterol and good cholesterol, but not all bad and not all good cholesterol are created the same. So nowadays you can have a specialized test at your doctor's office called, in different labs, it's called in different ways, but it can be called the smart lipid panel or the cardio IQ panel, where it doesn't just give you the absolute number of bad and good cholesterol, but it distributes by spectrometry the size of the particle, recognizing that in the bad cholesterol, the smaller the particle, so the denser the particle, is the more harmful or correlated with creating plaque in arteries as opposed to the big particles. So usually people give visual where they can say, imagine your big cholesterol particles as fluffy, big beach balls, as opposed to very small, dense bowling balls. So if you were hit with one of the two, obviously the bigger fluffy ones tend to be less harmful. So we can utilize this to make recommendations. It's more complicated because we don't have standardized recommendations, but we definitely can use it to guide those people who are what we find in the gray area of whether or not we should start them on cholesterol lowering medication. Another question is, can high level of anxiety cause heart disease? And the answer to that is yes. So we have very objective evidence. There's even a syndrome called broken heart syndrome, where we can see, and it's more common in women, that after a big trauma, women can develop acutely, so very suddenly, heart failure, and it's actually a recognized disease. But we also know, but it's less tangible and difficult to prove, that chronic anxiety, there is a connection between our central nervous system, our brain and nerves, and our heart. So the most obvious one is if we're in a constant state of fight and flight, which is anxiety, right? Our heart rate is always a little bit higher, our blood pressure is always a little bit higher. So that can obviously impact our heart. So I would say definitely yes. And there's a lot of studies that showed indirectly how things like meditation, acupuncture improve cardiovascular health. So that indirectly proves that anxiety is a cause of heart disease. Where can we find a good plan of the Mediterranean diet? Well, definitely online you'll be able to find. I'm happy to maybe post some of these resources that I've used in the past on our website, and maybe that way you can later on check. So you would give us a few days to update that and we can share. But if you just look up Mediterranean diet, there's pretty standardized information on how to get good sources of those omega-rich foods and plant-based diet. And the last question goes to, can we get the slides? And yeah, we'll be happy to share the slides. Again, give us a tincture of patience so we can upload them to the website. And if no further questions, or for the sake of time as well, we have a second part of our presentation. So we're going to move right on to that. So I thank you again for participating.
Yeah, thank you so much, Dr. Beraha, for leading us through our Matters of the Heart Q&A session following our presentation today on World Heart Day. We're at hour of your lunchtime, and just wanted to speak a little bit about the Cayman Heart Fund before everybody goes today. And my name is Alison Alaro. I'm the coordinator at the Heart Fund, and we are the cardiovascular charity for the Cayman Islands, and our mission is to improve the heart health of the nation. We try to do that through education, influencing policy, and various different avenues of support. You can see our contact details there. And just to go into a little bit more detail about some of our outreach programs and support options, we recognize our heart heroes. We have a display at the Georgetown Library, and every year we award and recognize people that have suffered with cardiovascular issues and try and raise awareness about what those cardiovascular diseases are. We work with school programs and healthy living and advice for schools. We have a summer program that teaches healthy eating and exercise classes to families. It's led by one of our directors, Dr. Christine Chen. And we also work on various assistance policies for the community. So over the years, the Cayman Heart Fund has fundraised and donated medical equipment to the Georgetown Hospital, including an EKG machine, different cardiac probes for the neonatal and children's wards, including an incubator, I believe, last year. We've provided supplies for the cardiac rehab program. And I think it was in 2016, we fundraised and purchased one of the ambulances for Grand Cayman. So that's just giving you a little bit of history about some of the things that we do. As Dr. Beraha mentioned, we do offer free public health screenings. We ran one of these in 2021 in July in the West Bay Library and saw over 75 people where they were tested for their blood pressure, their heart rate, and had their body mass index calculated. And then we did a test for their cholesterol and glucose. And then they saw a doctor to interpret those results. If you're interested in attending one of our medical screenings, if you follow us on social media or send us an email to be added to our mailing list, we can let you know when the next one is coming up. And we're hoping to do more of those throughout the Cayman Islands in the future. And lastly, just a quick note about the life-saving technology and skills that the Cayman Heart Fund supports. So we do have an automated external defibrillators program. We supply defibrillators to the community, and but we are obviously a non-profit organization. So for all the funds that we raise through that program, we use the funds to donate defibrillators to places in the community that need them. So we know that statistics are very damaging for people with out of hospital cardiac arrest. The statistics are kind of less than 1 in 10 people will survive unless they're treated immediately with CPR and an AED. An AED, you may see them in your offices, your schools, your workplaces, and we're hoping to get more of those in the community. And they're a bit like a robot paramedic. So they have the ability, anyone can use them to restart the heart if it's suddenly stopped beating. And patients that are treated with AEDs and receive CPR training immediately have a much better rate of survival. So that's what our program is about. If you're interested in learning CPR, and that is one of the ways that you could support the Cayman Heart Fund, there are many places on island that you can learn CPR and first aid training. And the wonderful doctors at St. Matthew's University run a course on Saturday mornings. And if you contact the Heart Fund, we can give you details of those courses. They run the American Heart Association, BLS, and life-saving course. And they donate the proceeds for that to the Cayman Heart Fund. So we always want to give a big shout out to the doctors there for doing that great work. And lastly, just before everybody goes, we are obviously a non-profit organization for the Cayman Islands for cardiovascular health. And we offer information sessions like this for free to the community to raise awareness about heart health. But if you would like to support us, there are lots of ways you can do that. Obviously, we'd love it if you are able to donate or fundraise for us. We do have a fundraising campaign right now. We're fundraising for surgery for Mrs. Alida Jerez Camejo, who's a Cuban national here in the Cayman Islands. Her husband is a refugee on island, and your donation will go straight to life-saving surgery for her. She's currently suffering from severe mitral valve regurgitation, and the cardiovascular surgeon has recommended surgery as soon as possible. So, you know, when we say your donations are life-saving, we really do mean it. You can get access to the donation page from the QR code on this slide, and I can share the details with everyone afterwards. But there are lots of other ways that you can support the Heart Fund. Follow us on social media, find out when the next public health screening are, support our events, maybe sign up for a CPR course, or if you're interested in helping us in any way or volunteering, our contact details are on the screen. So thank you so much for joining us this lunchtime. That's the end of our presentation today.
Do you want to check, Ali, if we have any questions?
I'll have a quick look more
to see about the Heart Fund or anything else? Oh, there's a question about gluten-free. Again, like I said, when I shared the pyramid, it's not a universal recommendation. It's more of years of me following certain experts on nutrition, and even experts such as Dr. Agustin, who is an eminence in cardiovascular, and he created this CT Agustin calcium score. There's a lot of controversial and information about gluten and what it could potentially do as an inflammatory agent. So by no means would I focus solely on whether the grains are gluten or not gluten-free, but in that pyramid is trying to promote not just cardiovascular, but metabolic health, which we feel underlying metabolic health, there is an element of inflammation that could be culprits in why certain people with similar diets and numbers, some of them have more inflammation that causes plaques in arteries. And as a matter of fact, we do use a lab test, which is validated, called the high sensitive CRP, which is an inflammatory marker to stratify people with high cholesterol, because we believe that microscopic amounts of inflammation signify that there is inflammation in vessels, which promotes what we call unstable plaque and growth of plaque in the arteries that can lead. So again, I'm not trying to be a gluten basher on the talk. Obviously, that's not the point. If you eat plenty of vegetables, plant-based, rich omega-3, but you're not gluten-free, I'm not trying to say that that should be the reason why things happen. But there is a lot of indirect and direct evidence pointing more and more that overly processed gluten, which is part of the modern diet and processed food diet, can lead to not only cardiovascular disease, but probably through the metabolic instability pathway to a lot of diseases. There's another question that says, I have a cardiovascular problem. Is there any problem with getting the vaccine or a booster? Quite to the opposite. Cardiovascular, when we first started with the vaccine campaign worldwide, and we were stratifying people according to risks, if you remember, the first group of people who were told to get the vaccine before everyone else were those over the age of 65 or 70, depending on the country, and those with conditions that made them vulnerable to get severe COVID. And amongst those conditions was heart disease, high blood pressure, and even obesity. So I would say it's actually a reason to get the vaccine and not against it.
So we did have one question from an attendee asking if we could get a defibrillator for a church. So yes, as I mentioned, the Heart Fund has an AED program where we supply them to the community. So if you're able to fundraise for the church, or if you have funds available, you can certainly get in touch with the Heart Fund, and we can give you the details of how to purchase one. We can help you fundraise as well if money is an issue. And if anyone on the call today and the webinar today has any suggestions for places where a donated defibrillator could go, we would love to hear from that too.
That is correct.
And the last question that just came through, do we offer free screenings at workplaces? Most of our public health screenings are by that nature public. So they would be in places for the community that anyone would be able to come to. That said, if you get in touch with us at the Heart Fund, we can always put you in touch with other clinics that can maybe offer that at workplace situation, or maybe we can do one in a public space nearby and people can attend in the lunchtime.
Agree. And but what we do offer for workplaces is educational talks such as this one. So if you're interested in your workplace getting a lunch hour educational talk, we're happy to do that as well.
Yeah, so I think unless there's any more questions coming through, I think we might have reached the end.
Yes, even in time to allow people to have lunch.
Yeah. So thank you again to Dr. Beraha for leading us through our Matters of the Heart presentation today. And thank you to all of our wonderful attendees for joining, and for Katie in the background, keeping everything technically working great. We wish you a very happy World Heart Day, and we will make a presentation, slides and recording available as soon as possible afterwards.
Bye.
Thank you so much and goodbye.